Good morning, everyone, or good afternoon, depending where in the world you are today. Welcome to today's webinar entitled Building Evidence to Impact Care Reform, Challenges and Lessons Learned. We've opened the room promptly at 9 o'clock, so I hope that everybody is here online. I cannot see who's in the room, so please do chat if I'm starting too early. Otherwise, we are ready to kick off. So I have been invited by the Evidence for Impact Working Group to be your moderator for today. My name is Victoria Olate. Many of you here in the room I probably know quite well, but for those who I haven't connected with before, I've been working in care reform from a programmes perspective and more recently from the research perspective for almost 20 years, and I'm a senior strategic research partner at Hope and Homes for Children. I'm going to do my best to guide us all through the next 90 minutes or so, both for those of you listening in English and those of you on the Spanish interpretation channel. The working group, as you can see here on the slide, for Evidence for Impact aims to foster a strategic and coordinated approach to generating and applying evidence for impact on childcare reform, on children's care policy, on system strengthening and on practice. And as part of the continuous discussion that we've been having as a group about what evidence is and how it can drive impact, this webinar is really an opportunity to hear from two working group members about their ongoing research projects that were designed to inform system strengthening initiatives. I believe that I've covered this slide. So as I said, I'm Victoria Olate. I'll guide you through. In terms of housekeeping, let's cover a couple of housekeeping points there. So the webinar is being recorded. That function is already on. Please use the chat function to introduce yourself. Great, I can see the first introduction there on the chat. Mr. Sam Venn, thank you for chipping in. Please do use the chat function to raise any queries as they arise, particularly if it's around interpretation or anything that we could correct for you during the course of our discussion, but also to raise any questions or comments as they strike you during the presentations. So there isn't an opportunity to unmute yourself to ask questions today, but you can pop those questions in the chat and we will field questions to the panelists later in the session. Just one other point on housekeeping there was around Menti. So we will be using a Mentimeter poll later in the session. So do have your phones or your tech handy, and we will be sharing a link that you can use later in the session. So nothing to do now, but have it handy for later in the session after the presentations. Thank you. Brilliant. So in terms of agenda for today, we are going to hear, first of all, from Lumos about their global thematic review that has been examining the well-acknowledged but under-researched relationship between education and institutional care. After that, we will be hearing from Changing the Way We Care, who will walk us through their child and caregiver surveys, which have been exploring protective factors and well-being after reintegration from residential care and within families at risk of separation. Each of those presenters will have about 20 minutes to walk us through that research. And as I said, after that, we will open for a question and answer session. So perhaps another 20 minutes where we can come to all of the questions that you put in the chat. As I said, please feel free to pose questions as we go through or save them for the end there. And I will field those to our panelists in due course. After that, we will have a discussion on getting to impact. So we'll try and get a bit more interactive. We'll do a Mentimeter poll. We'll have a bit of a chat through each of your experiences of using research and evidence to impact on children's care. We will close in 90 minutes time. I will come to Florence Martin, the Director of the Better Care Network, at the end for any final reflections. and we hope that we can keep you engaged for a lively discussion during that time. Thank you. Okay, so let's dive straight in. So we will move to our first presenters from Lumos. So we will be hearing from Jen Dixon, who has worked on care reform and child rights across multiple contexts for the past 8.5 years in evidence and learning roles. And Jen's focus has been on generating and using evidence to inform advocacy initiatives, policy and practice. She is currently the Senior Learning and Research Manager at Lumos. Welcome, Jen. Alongside Jen is going to be Lucy Halton, who's worked in child rights advocacy for the past 5 years, with a background in human rights law and direct work with children and young people. So Lucy is currently Advocacy and Campaigns Manager at Lumos, where her work focuses on the connections between institutionalisation and education and the flow of funding into institutional care in order to make tangible change for children. So over to you, Jen and Lucy. Do walk us through your research and its impact in terms of care and education.
Lovely. Thanks, Victoria. Thanks so much for the introduction as well. And it's lovely to see so many of you online. I know I've met some of you and not others. So yeah, thank you for being here today. Lucy and I are here to talk about a piece of research that we launched this year. It's a global thematic review on education and institutionalisation. Excuse me, I've also got a bit of a cough, so I do apologise. So this research, I know some of you are already familiar with it. We'll briefly go over the findings and we'll also share the report and the resources so that you can go away and have a more detailed look if you wish. But what we really are here to focus on today is how from the beginning, the research was planned and delivered by evidence and advocacy colleagues together so that we can make sure it was designed to support our advocacy goals and make real world impact. And when I say we, the original research was planned by colleagues who went on to leave Lumos, and Lucy and I picked it up after the data had been gathered. So we can't take any credit for what happened in those early planning stages. The overall aim of the project was to gather and synthesise evidence from around the globe on the interactions between education and institutional care, and to do this using a rights-based lens, and then to use that to advocate for including education in care reform, and importantly, mainstreaming care reform in the education sector. And we hope to get care reform to be considered in education policy making, and also to ensure access to quality education is a key consideration in care reform, which I'm sure we all know is a really important priority. So the findings and messaging would be targeted not only at those involved in care reform, but also at stakeholders within the education community who were key influencing targets for us. And we also intended to produce resources that would be useful for those working on care reform, especially as they engage with the education sector. Can we have the next slide, please? So the advocacy goals were set out at the planning stage. Our project was funded by UBS, and in the proposal we included a lengthy advocacy phase to follow on from the launch of the research paper, so that we could be sure that we weren't just going to put the research out there in the world, but that we were going to intentionally give ourselves both the time and the capacity to use it for impact and to influence those that we wanted to influence. The research comprised a literature review, which was conducted by UCL, a call for evidence, focus group discussions, and then there were 4 case studies looking at Colombia, Moldova, Indonesia, and the EU. And the Indonesia case study was done in partnership with Perkins International. And then we did a secondary analysis of some of our historic programmatic data from 5 European countries that Lumos has worked in. The call for evidence went out to individuals and organisations working in sectors that we hoped to ultimately influence with our research. And the focus group participants included experts and researchers in education and institutional care, policymakers, practitioners, and civil society representatives. So not only were they able to provide valuable information, they were also people who we hoped would buy into this research and take the findings forwards in their own work, so extending the reach and the possibilities for impact. Can we have the next slide, please? So to run through the findings very quickly, the first set of findings was about the drivers of admissions to residential care and residential education. So firstly, a lack of non-residential options or a desire to access real or perceived opportunities that residential services can bring was perhaps unsurprisingly a key driver of admissions. Secondly, poverty and related issues such as poor housing can also increase the likelihood of admissions. And that can be because residential services can offer or be perceived to offer better care and material things like school books or clothing that would otherwise be unavailable to children. Third, a lack of accessible inclusive services with children with special educational needs or disabilities. And in some cases, residential services were the only way that these children could access schooling. Then discriminatory treatment of marginalised or disadvantaged communities also drives admissions. And in some contexts, state actors allow or justify the institutionalisation of certain populations of children in a way that disproportionately affects those from marginalised or disadvantaged communities, such as Roma children in England and Indigenous children in Colombia. There were also a range of other factors which featured less prominently in the research, including abuse and neglect, behavioural issues, and children being in conflict with the law. Can we have the next slide, please? The second set of findings is about the impact of residential institutions on children's education and lives. So if we go back one slide, we should be on the right one, please. Yeah, that's brilliant. Thank you. So we looked at school attendance and access to education and found that both residential education and residential care can enable access to learning opportunities, but that certainly wasn't always the case. Some children in residential services, including those offering education on site, were not attending lessons at all, in particular children with profound disabilities. So being in a residential school doesn't necessarily mean you're being educated. Then in terms of academic progress and relationships at school, there was a mix of positive and negative outcomes. And some studies found improved academic outcomes for certain populations, including children living in severe poverty or from disadvantaged or marginalised groups. But other studies found that children's academic performance was negatively affected. We looked at health and well-being outcomes, and again, both positive and negative outcomes were found. Really importantly, though, disrupted family relationships and dislocation of children from their home communities were found to have an adverse impact on children's sense of identity, emotional development, and mental health. And that's something that can't be overcome, no matter the quality of the service. And finally, negative safety and harm-related outcomes were found, including bullying, physical, sexual and verbal abuse, and other forms of violence. And children in residential services can often be very isolated from their families and from external health and child protection services. So that makes it really hard for them to then report the violence and for it to be addressed. So adding another layer of risk. And that's something that came through really strongly in the Colombia case study. Can we have the next slide, please? The third set of findings is about how policy and practice can enable children's access to their rights to both education and family. So firstly, a legal and regulatory framework is vital to ensure that all children can access non-residential education that meets their needs. The Moldova case study highlighted that, describing how a framework for inclusive education was developed within the government's care reform process. Secondly, a multi-sectoral whole system approach at all levels, from government down to families, can help address the broad range of social and educational drivers of residential admissions. And that was examined particularly in the Moldova and the EU case studies. And finally, it's unlikely that the full range of developmental harms from residential education settings can be overcome by making improvements to services. So the research looked at interventions aimed at improving institutions' cultures or children's outcomes in other ways, and found that some positive outcomes happened. Some children benefited from better academic qualifications, but others left children continuing to face a range of challenges, so including progressively worsening emotional and behavioural problems or a lack of academic improvement. Can we have the next slide, please? So to move on to the conclusions and bringing in some of the key messages that underpinned our follow-on advocacy initiatives, in many parts of the world, families are having to choose between their child's fundamental rights. So that's the right to education and the right to a family life. And we know that one right should not come at the expense of another, and that change is possible to ensure that all children can access both. Secondly, socio-economic vulnerability increases the risk of unnecessary separation of children and families, and drives entry into residential education settings. So there is a strong need to address this and to ensure that multi-sectoral solutions are found. Thirdly, being in residential education can and does harm children's health, well-being and development, as it does in residential care institutions. So residential education shares many characteristics with residential care, and many of the harms of residential care are also present in residential education. Then access to community-based, inclusive, high-quality education is key to a successful care reform process, ensuring it is inclusive and accessible to all children, including those with disabilities and those from other marginalised or discriminated against groups, including Indigenous and First Nations children, children in street situations, or who are refugees or who are living in poverty. Then understanding addressing norms, attitudes and practices is a key lever for change. And finally, that reform processes should involve both the social care and education sectors with joint planning and collaboration. And coordination is needed between the two sectors, involving relevant government ministries and other key actors. I'll hand over to Lucy now to talk about how the findings were used during the advocacy phase.
Thank you, Jen. Could we have the next slide, please? Great, thank you. So as Jen said, advocacy for system strengthening and for meaningful change was built into this project from its outset. So it was really important to us, firstly, that the products we used to disseminate the research were the right ones. And secondly, that the information included in them was relevant and useful for our specific target audiences and not just for us as an organisation. So we therefore started by launching a working paper in early 2023. The working paper included the key information established through the research to date. It was launched at an online virtual event. Several of our research participants, particularly individuals and organisations who had taken part in focus group discussions, acted as panellists at the launch, which was really important to us as part of the continuity of the piece of work and of our research participants acting as champions of the message and the findings, alongside other high-profile speakers such as UNICEF high-level representatives. After this, we went on to hold a parliamentary launch of the working paper in Moldova, so bringing it down to the national level. The main aim of that event was to reinvigorate the national conversation in Moldova on full-scale education reform, given where that country is in its progress on care reform more broadly. We then held a virtual intergovernmental roundtable, which brought together representatives of 4 governments across 3 continents to have an open discussion about the challenges of reforming residential education systems. The roundtable was closed and was held under the Chatham House rule, which means that the discussion is protected and enables the speakers to speak freely and honestly. It wasn't facilitated by Lumos. We brought in an external expert facilitator to make sure that conversation was open and honest. We also held an online NGO roundtable where we brought together key education sector actors alongside some of our care reform peers to review in detail a draft policy brief on this piece of work and ensure that the recommendations it was making were fit for purpose for this specific audience. And of course, we also held lots of bilateral meetings with key actors in the global education space, building on their knowledge and helping them to understand the relevance of this issue to their work. Throughout this phase, our key messaging was something that Jen has just mentioned, which is the notion that many families are effectively being forced to choose between their child's right to education and their right to family life. This messaging has really enabled us to cut into a new sector, the global education sector, and seems to be resonating very well. Could I have the next slide, please? So, building on all of these interactions and what we learned from them, we designed a research pack to be useful to our audience. We learned quickly that people didn't want a lengthy traditional research report on its own, especially policymakers who are time poor and face many competing priorities. So the pack includes, as you can see, 2 policy briefs, one which is aimed at governments and one for NGOs, 4 case studies, event recordings, etc. The policy briefs in particular are really focused on recommendations which centre systems change, so specifically the elements and changes that are needed to reform residential education systems as part of childcare and protection systems reform. We also, in addition to this, had 2 op-eds placed in media outlets to further disseminate the message of this research to a wider public audience, as well as the tailored policymaking and NGO audience that was at the heart of this. Could I have the next slide, please? So just to give you one small example of impact and progress that we are seeing on this area, something that many of you will already be aware of is the recent UNICEF Europe and Central Asia Regional Office white paper on the role of boarding schools for vulnerable children. So we were pleased to be part of the reference group in developing this report, which enabled us to contribute the learnings that we'd generated through our research. But in particular, we were pleased by the inclusion of several recommendations that really reinforce and strengthen the recommendations that we've made throughout our research. So in particular, the one that you can see in the 3rd bullet point, which recommends that states recognise boarding schools as part of the continuum of alternative care, regulate them as social care and education providers, and include them in the institutionalisation and childcare reform policies and programmes, as well as in inclusive education reforms. This is really kind of central recommendation that we are emphasising in our work with government. Could I have the next slide, please? So this work was initially funded by UBS Optimus Foundation, and while that funded period has now come to an end, it remains a key priority for Lumos as an organisation. So this topic of education is at the heart of our new advocacy strategy, which will take us into 2027. So we'll be focusing significantly on amplifying what we know works when it comes to reforming residential education. So specifically pushing for states to include residential education system reform within care reform processes. And to do this, we'll be continuing to facilitate state-to-state learning opportunities and also providing platforms to disseminate those promising practices that we see in this area. And at the same time, the other strand is really about continuing to engage the global education sector in order to really build that sector's knowledge and also ownership of this issue, with the ultimate aim being that through the influence that the global education sector has, to make change at state level. We are also seeking to deepen our work, so the research that we've done to date, which Jen has summarised, has mostly been at quite a high level. So we are now also collaborating with the Open University on a more focused piece of research on the relationship between education and institutionalisation in the Kenyan context. I'm going to hand back to Jen now to just talk to you about some of the lessons we've learned through this process.
Thanks, Lucy. Can we have the next slide, please? So in terms of lessons learnt, we know from this project that planning research together with advocacy colleagues increases the chance of impact. So from Lucy's presentation, we could see how many opportunities we've secured already to talk about the findings, and to bring in different stakeholders and really listen to their views and incorporate what they're saying into the materials that we can produce. And we did that, and we were able to do that because we really considered what research areas we needed to underpin those advocacy efforts. So we had that planned in from the start. Planning and resourcing and advocacy phase also allowed us to maximise the impact of our research. We wouldn't have been able to commit the resources and the time needed to do this amount of advocacy if we hadn't written it into our funding proposal. We also saw that involving key stakeholders in the research process increases buy-in and helps secure champions. As Lucy mentioned, an example of this was that some of our participants sat on panels discussing the findings and were able to champion the key messages amongst their own colleagues and audiences. And then finally, building effective influencing relationships in new sectors requires capacity and longevity. So to achieve real impact, long-term resource is required. The education sector is large and care reform is often not high on the agendas of the key actors within it. So it's been really valuable to be able to take the time to make the inroads needed. And part of this has been about consulting stakeholders and involving them in shaping the messaging. So that's not a quick process, but it's been a really important one. And it's certainly something that we'll be sure to plan into future research projects. So that's all from us. Thank you for your time.
Thank you, Jen. Thank you, Lucy. There's a lot to take in there. Clearly a very, both an expansive and a deep piece of research there. I think lots of learning points that we can take away from that. Maybe the one that struck me right from the very beginning was so clear that you planned for impact via advocacy from the outset, and you've really highlighted there that research and advocacy can be intentionally and intrinsically linked from day one. So thank you very much for sharing that with us. As I said, everybody, please do pop your questions in the chat as you're listening. If you've got anything that you would like to ask Jen and Lucy to clarify areas of the research or to dig a little deeper on some of the points they've mentioned, please do write that in the chat. We are going to move to our second presentation now. So that will be changing the way we care. So we're going to hear from Jo Wakia, who has been involved in child-focused monitoring, evaluation and research for the past 20 years, supporting approaches which bring out children's and caregivers' experiences of family and child separation, reintegration and alternative care. She's part of Maestro International, where she is currently the Monitoring, Evaluation, Accountability and Learning Director, supporting care reform, particularly in Guatemala, Haiti, India, Kenya, Moldova and beyond. So welcome, Jo. I'm delighted that alongside her we will have Roberto Tejada, who is the country director in Guatemala. He's been working for 19 years in child protection, in advocacy for living in family and children in residential care, prevention and family strengthening, as well as food security and humanitarian aid projects. So Roberto has been working closely with the national and subnational governments, NGOs and civil society organisations, and in partnership with the churches from the US and Guatemala to mobilise resources towards family strengthening. So I think we've got plenty of experience, or they have got plenty of experience to share with us here. So Jo and Roberto, I will hand over to both of you.
Great. Thank you, Victoria. And thank you, Jen and Lucy, for such a great presentation so far. Really exciting. I'm delighted to be able to bring to you today some of the findings from a piece of research that we undertook within Changing the Way We Care, a survey of children and caregivers to understand their what was going on with their protective factors and their well-beings, as has been mentioned, across 3 different countries that we work in. If we go on to the next slide, please. Changing the Way We Care is a global initiative that has been designed across 3 different levels of operation, starting with a local demonstration of services needed within care reform, and using that to influence out to national and subnational systems change, and then using that again to influence out into the global and regional care sector. And the design of our initiative very much has learning and evidence as the thread running through it. We consider learning to be the way that we connect across the different parts of the initiative, taking lessons from the local up to the national and back down again, learning from different demonstration countries out to others, and bringing in learning from the global sector. So learning is really the heart of changing the way we care. And one of the commitments we had from the very beginning was that we would contribute to what we saw as the gap in evidence around outcomes for children and caregivers who were either reintegrating or being placed into family care from residential care or being supported to prevent separation. It's this commitment to generating this learning is very much embedded alongside our practice, and planned from the very beginning, and there to really drive the change that we were after. If we go on, the way that we sought to understand these outcomes at the child and caregiver level, onto the next slide, please, was through a survey with participants from in our services. We had 3 aims: to understand how well the services that they received were being received, if it was impacting on their ability to care for their children, and to explore what protective factors looked like for caregivers and how well-being was experienced for children. As I say, we've undertaken this survey across 3 countries, Guatemala, Kenya, and Moldova, and we'll hear a little bit more about each of those. And we've now undertaken 2 rounds of the survey, first in year 3 of our initiative, so 6 years ago now, and a second round a year and a bit ago now. Yes, so we're really excited to be able to bring some of these insights from this level and see how, and explore a little bit about how it has impacted on the wider work of changing the way we care and system strengthening. So let me tell you a little bit more about the survey itself. If we go on, it was quite a, onto the next slide, please. It's quite a complex survey methodology that we employed because we were interested in looking at a range of different aspects within families. So we had a caregiver self-report, which told us about themselves, their household, and the children that they care for, employing as many validated survey measures as that were relevant for us that we could manage. The caregivers also told us about their child's well-being, if they were under the age of 10. But we also felt it was important to hear directly from some of the children themselves. And so we co-designed with children and young people in Kenya and Guatemala a child self-report that reflected their experiences of reintegration. We couldn't find an existing tool that already did this, and that was relevant for the context in which we work. And so they helped us to design a series of well-being questions, which we then paired up with some other validated tools that we found that would complement it. So we had a great opportunity to hear from young people themselves and have them as part of our research team. On to the next slide. I'm going to whiz through some of the findings from the 3 different countries. I might go a little bit fast, perhaps. Forgive me, but I want to give you a flavour for the findings from all 3 countries, and then I will allow Roberto to tell you a little bit more about how that has been taken forward in Guatemala. So in Guatemala, we received very positive feedback on the services that Changing the Way We Care had provided, including case closure. By the time we did the second survey, cases had been closed for 18 months. And so we were very much looking at what had changed in the 18 months between the surveys, and understanding what life was like after case closure. On to the next slide. we were able to see that caregiver protective factors were high and had remained high even during the period after case closure. And the same was true for child wellbeing. You can see here that our protective factors look at 4 different areas. 2 are more internal to the caregiver and 2 are external. And with our child wellbeing, we were able to create 3 subscales across quite a broad range of factors. And the only place where we saw change between the 2 rounds of our surveys was the external protective factors. So there had been a small but significant decline in the level of those protective factors as the caregiver perceived them. And this perhaps was not unexpected, given that some of their support had changed during those 18 months. They were no longer receiving case management and direct support. But overall, the situation remained high and positive. If we go on, we also saw that this was true in how the children were thinking about their overall life satisfaction. So we asked a question about how they felt at home at the time of the survey, and then when they looked back retrospectively on their time in residential care, how they felt then. And you can see here that in the second round of our survey, children in Guatemala were feeling very positive about being at home. And when they looked back at their time in residential care, it was much more lower rating in terms of their sense of satisfaction. And there wasn't any significant change to this between our 2 rounds of our survey. So children were very settled and considering their life at home to be very positive, was the conclusion from the survey in Guatemala, which was very encouraging for the work that we were doing, which you will hear more about. But before I hand over to Roberto, I am going to let you into some of the findings for Kenya and for Moldova, because they revealed some very different situations. So if we go on to Kenya on the next slide, here again, we received very positive feedback from the caregivers about how they found the services that they had received, feeling like it helped them a lot to care for their children, but a much more mixed picture about how they felt about their preparation for case closure, which had happened much more recently when we did the second round of the survey in Kenya. In Kenya, as you may know, under COVID restrictions, many of the residential care institutions were closed and children were rapidly returned to family. And that had happened right kind of a little 6 months or so before we did the first round of the survey. In between the 2 rounds of our survey, our teams had traced children and put case plans in place and had begun the process towards case closure as well. And that's important to keep in mind as we go on to the next slide, please, and look at the findings around protective factors and child well-being. We found that, again, there was quite a high level of protective factors and well-being in general, particularly around, I do apologize, some of the formatting on my slide appears a little strange, so I hope it's still followable. The internal factors, protective factors for the caregivers remained high. So their resilience, their ability to be socially and emotionally competent with their children, their ability to care for their children had remained strong. And that is reflected in how the children were feeling as well. Their sense of care and safety in particular had remained high, and leisure and freedom as well. But we saw quite a difference in the external protective factors for caregivers. They rated these much lower. And as well, if you look at the child well-being, the basic needs, the child's sense of their basic needs being met had declined between the 2 survey rounds significantly. And we have conducting some follow-up feedback with some of the families who participated in the survey to understand this dynamic a little bit more. And there is clearly a sense of the economic strain playing a part in what was happening within these families. They had gone through this rapid reunification under COVID. COVID had had a significant impact on the economic situation in Kenya. And there was, a struggle going on there providing for children. If we go on to the next slide, you'll see then how this plays out as well on children's overall sense of their life satisfaction. In the first round of our survey, so quite soon after children had returned home, they rated their perspective on their life at home at the same level as when they were thinking back to their time in residential care. They were giving it about a 7 out of 10 for both. 18 months later, in the second round of our survey, after they had been at home for a lot longer, the children were now feeling like their life at home was of a lower level of satisfaction. That had dropped to around a 6 out of 10. And they were now looking back on their time in residential care more positively. So quite a distinct change here. And again, as we gathered some further feedback on these findings, it very much seemed to be linked to education and economics, which is many of the same issues that you've heard Jen and Lucy already talking about, that in Kenya, many children enter residential care because they are looking for education opportunities, because families feel like those residential care settings can provide for the basic needs of their children that they are struggling to meet. And that appears to be what is playing out in the findings of our survey. So some really important insights for us to be learning as we are during our ongoing work in Kenya. Thanks. Let's just quickly pop over to Moldova, where we get to see something different happening again. We've only done one round in Moldova, and as you've also heard from Jen and Lucy, Moldova is in a different situation with care reform. They're much further through this process. In Moldova, the children and families that Changing the Way We Care has been working with have been much more, many more foster carers and many more children with disabilities. And we really made a point of making sure that we had the ability to understand what was going on for both caregivers and children with disability in our survey. And that has revealed some very interesting insights. We had positive feedback again on the services that have been provided. And when we go on to the next slide, please, you'll see that again, we have found strong protective factors in the families and a high sense of child well-being as well. We got the same pattern where, sorry, it's all slightly misaligned, but we've got the same pattern of internal strengths, protective factors, and slightly weaker external protective factors. And here in Moldova, it is the leisure and freedom and another scale that we looked at around community acceptance, which seem to be weaker areas in children's perspectives in Moldova. And this, again, plays out quite clearly in the overall life satisfaction. On the next slide, please, where we see quite a difference for children with disability. So overall, on average, children were rating their lives about an 8 out of 10 at home. I think if you click one more time for me, there should be another element that pops up. Thank you. But children with disabilities were giving a very varied response. They were rating their lives anywhere between a 4 and a 9, while every child who does not have a disability was giving it a 10 out of 10. So there was a stark difference between the experiences of children with a disability and those without as they are leaving residential care and entering into family care. This was a pattern that we saw across all of our data sets, actually. Once you start looking for the differences between people with disability and those without, nearly all of the outcomes that we were measuring had some kind of difference there that was really important for us to understand better. So just briefly on the next slide, before I hand over to Roberto to tell you a bit more about how these findings have been used in Guatemala, I just want to flag for you how important we have found having this research embedded alongside our practice in Changing the Way We Care, and being able to use it ourselves to inform the way that we are delivering programming directly with children and families, but also increasingly being able to use it within our system strengthening work and being able to use it as a basis for advocating for change and for informing policies and practice guidelines. As I say, Roberto will tell you more about Guatemala, but in Kenya, it's been really important to flag not only that case management is important and that process of supporting reintegration is important, but that it can't be the only part of how we helped families reunite from residential care. There has to be an emphasis on family strengthening and on education, as you've already heard so much about from Lumos. It's really important that those messages and those ways of practice are built into the system strengthening work, which we are working towards in Kenya. And in Moldova, in this last leg of their care reform, when there are many more children with disabilities now in the forefront of the work, we are delighted to be able to raise this issue up and are now running alongside the government a pilot around foster care for children with severe disabilities to really be able to unpack what is needed for those families in terms of recruitment, training and support, and also a pilot around linkages to family strengthening and how we can support families at that most local level, and including within that addressing any misconceptions that exist around children with disabilities and addressing any stigma there. And those pilots, as I say, are run alongside the government and therefore have an embedded way of feeding up into the system strengthening movement at this point in the care reform process in Moldova, which is very exciting to see happening. So that is all from me, and I will hand over now to Roberto, who will take us in more depth into the work in Guatemala.
Thank you, Joe. Well, as Joe was explaining, there are several uses that we've been finding for the household survey, but most relevant for us has been raising awareness among main actors within the protection system at a national and subnational level within the government in Guatemala. Household survey findings have helped changing the way we care to raise awareness for preventing unnecessary family separation in Guatemala by promoting the right of children and adolescents to grow up in a safe and an environment family. But also to raise awareness about approaching services to those families living in communities where they have no access or minimum access to services. If we go to the next slide, I'd like to take you to just a snapshot about the reality of children and adolescents living in Guatemala. And when we talk about this reality, we have to realize that children in Guatemala suffer about poverty and exclusion, and this poverty and exclusion sometimes translates into residential care institutions. So children are removed from their families to live in residential care. But household survey confirms that this reality can be changed or modified, this reality, if we follow up an organized and coordinated process after children comes from the residential care back into their families. If we work within the community and local governments to create a network of services. So it's important that we raise awareness within local governments that to emphasize that this reality can be changed if there's a network of services around families within the community. Using the results in Guatemala, it's been around having conversation with central and local governments. The team has used the results in different presentations and activities with municipalities and with the current government in Guatemala. And the response has been positive to implement changes in care. Again, there are lack of services within the communities. So one of the main challenges that the family faces are that there are not enough services in the communities. So the strategy is to show that with a coordinated and organized process, if we create these networks, families don't have to go through unnecessary separation. So we use these conversations to build, to raise awareness around implementing a case management methodology. And that's it's been one of the most relevant outcomes that we have had in the last year, building conversation around the household survey results. If we go to the next slide, please. We also like to highlight that informed practice in Guatemala outcomes is about strengthening parenting skills. We have informed government, central government and local governments that while we provide workshops and parenting skills to strengthen families, to strengthen parenting, families don't have, families minimize the risk of separations. Also, we have promote the support of social-emotional among families. So local governments of subnational governments are offering psychological services to families so they can face these challenges among their reality in communities. Also, the promoting of the creating of these networks. The results are that this network have been created to support community and provide support to families in risk of separation. If we go to the next slide, we are going to find some of the use that the household survey has been informed also in the region, especially in Mexico and in Peru. Excuse me. In Mexico, the National Congress of Child Protection Attorneys in San Luis Potosí back in 2023 was well received. Government of Mexico was surprised because they do not have evidence about the outcomes of reintegration in Mexico. So they have been highlighting the importance about documenting of a well-coordinated process of reintegration. So their major problem is that they don't have a methodology to continue with case management and for reunification. Also in Peru, within the government, national and subnational government, they are very interesting. Actually, we are partnering with a local organization in Peru, Cambiando Horizontes, with a pilot that is informing the local government about the results of a case management methodology. This result has been very relevant for stakeholders, for decision takers, to ensure that they are monitoring the reintegration, which is important to make changes within the system. So also we've been informing Mexican and Peruvian local governments in order to provide evidence to change the system in order to have a case management methodology. In Guatemala, if we go to the next slide, please. In 2024, we have been speaking with the government, especially with the social protection system, to utilize the household survey results about having a protocol methodology in place to provide a case management methodology. Currently, the government does not have in place a methodology, a unified methodology to coordinate reunification processes. So changing the way we care is being used in household survey results to influence and to articulate messages, key messages, so we can build this conversation at a national level, but also to connect with the subnational level to provide more services for to create these networks and prevent unnecessary family separations. So household survey has allowed us to have evidence to back up this methodology of case management, allowing scale this methodology not only at a national level, but also as a subnational level. And the strategy is to connect these efforts. The changing the way we care has been working around communities at a subnational level with the national level to create this bridge to provide more services and prevent unnecessary family separation. So our major use of this result is building conversation to raise awareness for decision makers to implement a case management methodology, to have an organized unification process. Thank you.
Thank you, Roberto, and thank you, Joe. You have both shared some really incredible work here, where you've really identified the critical evidence gap and stepped into that gap to generate the programme-based evidence and to build a really broad platform of influence. Roberto, you spoke a lot about raising awareness, engaging government, showcasing data, both to your national government, but also to other countries in the region, as well as the implications for changing the way We Care's own programming and practice. So there's a huge amount for us to digest there. Thank you, both of you, for sharing that with the group. I'm sure that our audience online will be taking many different angles from that. I think what strikes me about both of these presentations is actually that both Lumos and Changing the Way We Care are very strongly placed to bridge this gap, to be able to find and identify the evidence gaps on the ground as they relate to children and families in country across the world, and to step in and generate evidence that fills that gap, and to be able to use that for influence. I can imagine that some of our audience online are seeing the benefits of that, but also wondering how to apply this kind of thinking in perhaps smaller organisations or where resources are less available. You've touched on issues such as the resourcing needs and the longevity of the commitment needing to this kind of endeavour. So it'll be great to hear some reflections from others on how this stands in their own experience. Great, I was going to say if we can have all our panelists back on screen, which I think we've got, so I can see Joe, Lucy, Roberto and Jen, great. So we're going to open up for some Q&A. Please do continue writing your questions either in the chat or in the Q&A function. I can't see any questions in the chat, but I can see them in the Q&A. So hopefully I'm not missing anything. I'm going to just read these out for the panelists to then come in. Please, feel free to unmute yourself and answer or put your hand up, or between you we will find the answer and I will field it to you if it's relevant to your particular presentation. So I'm going to start here with a question from Eob Negash, who says, what are the positive outcomes or benefits experienced by children in residential education systems based on your analysis? So what are the positive outcomes for those in educational residential care? And what is the role of the private sector in transforming those education systems in line with childcare reform? So Jen and Lucy, this is particularly one for you, and then perhaps Joe and Roberto can add in if they've got further thoughts.
Yeah, thank you for the question. I mean, one benefit is sometimes it's the only way that children can access education is to enter a residential service. So there might be no inclusive education services in their communities, or as we saw in Colombia, there are lots of children that live in really rural areas, far away from schools. And so the only option is to enter a residential school. So of course the benefit is the access, although of course it comes at the expense of their right to family life and so on. We also found, like, children, particularly children when they're coming from situations of poverty, may not have access to enough food at home. Their family home might not it might not be very good quality, and they might not have access to other things like material things like books and clothing. And in some residential schools they will gain access to those things, or I mean, the other thing is sometimes it's perceived that they would gain access to them, but actually in reality they don't. So there can be sort of material benefits in that way. There were some studies in the literature review which found that there were improved academic outcomes for some populations. So some of those groups included children who had behavioural challenges, who came from high income contexts, and also children from situations of extreme poverty or who are disadvantaged or marginalised. But then there were lots of studies that showed the opposite as well. So it's a really varied picture. There are also some specific cases where children had improved physical and emotional health during their time attending a residential school. But again, that was not the case across the board, and sometimes the opposite happened. And so a lot of this stuff came out of the literature review, which was done by UCL, and that's going to be published as an academic journal paper. And once it is, we can probably share it via this platform, and then you can see the more detailed findings from all of these different studies. It was really interesting. Thank you.
And I'm happy to jump in on the role of the private sector, which I think was the other half of that question. So the role of the private sector wasn't a specific research question in the research that we did, and in the literature review, it didn't come through very strongly, probably because of the questions we were asking. However, once we started the advocacy process on this research, it did come up very frequently, particularly in certain contexts. So in some countries, this isn't really an issue to any kind of significant degree. However, we had conversations, particularly with actors in the Kenyan context and the Colombian context, who were really telling us about the key role that private education providers, but also private funders, are playing in supporting systems of residential education. So one thing that we are thinking about as we move into this next strategy period is how we can better engage with education funders in particular. So with my other Lumos advocacy hat on, I work a lot on funding flows, and so we're trying to think about how we can engage specifically with some of those actors. But as we know, there is a kind of growing proliferation of a certain kind of boarding school model that's being exported into certain contexts through some private contractors. So we need to do some more thinking and talking to people about how we can best respond to that. It's a really good question.
Thank you. Joe, Roberto, anything to add to that from your own experiences?
I mean, just to re-emphasize what an important topic this is, and it was such a clear intersection, I think, of the two pieces of research, that the issue of education and the role that it plays in children's care and the importance of addressing it. I really want to re-emphasize the importance of the joined up approach of trying to bring these two topics together to address these issues, and doing that across all the different types of actors is so important.
Absolutely, that cross-sector engagement has come through really strongly, and I'll just add a snippet from Hope and Homes for Children, because we've also been researching very similar to research to changing the way we care on well-being outcomes and protective factors and risk factors in South Africa. And again, education came up as a very hot topic within that, and one where perhaps the nuance and the findings were more unexpected or more challenging, certainly for us to deal with when prioritising children's care. It's those educational pieces that are coming up as being real challenges in the lives of children and family, both as a driver and a consequence, and everything in between. So yes, I would second or third that from our recent research perspective, it's certainly been the case as well. I'll move on to another question. So I've got two questions here from Kieran. So Kieran Modi would like to ask, when we publish academic articles, how can we understand its reach and outcomes? And another question that she posted just a little bit after is, what are some of the best ways to seek collaboration and funding to do large-scale research, and what are the challenges? Any tips for this in the Indian context, please?
you want me to jump in there? I mean, definitely challenges that you're raising there, Kieran. Let me look at that first question about how do we, when we publish academic articles, how do we understand it? I mean, there are a few really clever tools out there for tracking what goes on with academic publications, which is helpful when they're in a journal. There are different metrics that allow you to understand, you know, the reach of those papers, and that is helpful. And it is fascinating to look back at ones that you've been involved with and to see where they've led, and to look for how they've been referenced by others. And I think that's the main way. But I think perhaps more importantly is to think about how you're using those articles once they are published. How do you make people aware of them? How do you encourage the use of that information? And linking it, if you're not seeking an academic audience, if your audience is somebody else, thinking of how else to present that information. I think the Lumos example included some great ideas around policy briefs and shorter ways of presenting information if you're looking for other audiences. And I think that comes back to your point around collaboration. I think collaboration was a theme across both our presentations as well, the importance of involving people as you move along. We really enjoyed engaging with children and young people as part of our process, but also with practitioners along the way, making sure that we had, you saw the nice long list of names that I wanted to get in on our slide at the end there. You know, these research projects are rarely the endeavor of one person or even a small team. They require lots of people, and finding ways to engage people along the way really helps finding roles and keeping people informed and looking for ways to provide feedback all through the process. I think super important. The funding issue is a tricky one, isn't it? It is difficult, but I think research within bigger endeavors is appealing. Making sure that it's research with a purpose and that it's part of something bigger can be a really great way to make that appeal to the donors out there. But let me give space for others as well.
Yeah, my main answer to that would be what you just said, Joe, which is the importance for a lot of donors of having research as a component of something bigger. I think most donors do want that impact focus, and being able to show a programmatic and advocacy and policy connection with the research is really important. And I think we're also seeing a funder trend in kind of innovative research approaches being particularly encouraged. So participatory research particularly seems to be a funder priority at the moment.
Great, thank you for those responses, guys, and hopefully that gives you some food for thought, Kieran, in the Indian context and in other countries as well. And particularly that point at the end there around participatory research. I know a lot of people on this webinar today will have are involved in programming and working directly with children and families, and how do we lift those voices and experiences. And I think the methodologies that you've used in the research presented today has really tried to pull that through, and I think there's still much further for us to go as a sector in centering the voices and experiences of children and young people as research participants, as research leaders, and in all kinds of new and important ways. I will just move us on to the last question that we've got here, which is, it's a quite specific one, so I'm not sure how much we'll be able to answer it, and maybe people can type into the chat if they've got any feedback as well. But it's from, we've got Sam Ven in Cambodia talking about the issue of mothers in prison as a particular concern, where although the children are at risk, the prison environment is not suitable for their needs. Have other countries, are other countries experiencing this issue? And is there any research or findings or examples of how evidence-based practices for children accompanying their mothers in prison have been successfully integrated into care reform initiatives? Those lessons could be really applicable or relevant in Cambodia. And I think that is the essence of the question there. So is that an issue that came up in your research that you've crossed over with? And do you have any thoughts on what lessons or principles could be applied in that case?
So I'm going to take my Lumos hat off for a moment. This is not an issue that our research touched upon, but in a previous existence, I worked at the Quaker United Nations office in Geneva, who have a whole work stream which is about the children of incarcerated parents. And so there is a large international body of research and best practice on this. I'll try and share some links in the chat. I don't want to derail completely now, but there is a significant body of research, and you're very much not alone in this. It's a big problem, and in a lot of Latin American countries as well. I can see in the chat already there's a comment about El Salvador, but yeah, it's a significant issue, and there is international guidance that exists on best practice for this. So I'll try and share some links as well. I'll put my email address in the chat too.
Thank you, Lucy. That's a really helpful follow-up, and it's great to hear that there is a good body of evidence and something that we can help our colleague to delve into. Any other thoughts from other panelists on that question before I move us forward? Okay, I'm just going to flip back to the chat to see if there's any other question. Plenty of others here. Let me just scroll through a little bit to see if I'm missing. Okay, so we've got comments in the chat there which are all on that issue of incarcerated parents. Okay, in which case, panelists, thank you very much for participating in the question and answer. To just follow up on your excellent presentations there. We have saved around 15 minutes for a conversation on this really important thread of evidence for impact. So I think we've got a slide. If I can ask Margot to potentially bring up the next slide. So what we wanted to do here is just have a more interactive moment to look at really the fundamental but not so easily answered question of what is evidence, how do we ensure it has impact, and by extension, how do we understand what impact that is? And the particular part that we're going to look at today is really the challenges that you're all facing in your work around ensuring the successful application of evidence for impact on childcare system strengthening and system reform. And we have heard from our colleagues on their particular pathways, but what challenges and experiences are you having in your own countries? So if you grab your phones or your technology and open the link that we have shared on the screen here, you've got a QR code and you've got a numerical code if that's better for you, to use on Menti. So you can use the app on your phone or online at menti.com. I won't be able to see directly. Joe, I don't know if you can unmute and support me on this one, but I believe that we're not showing anything else on the screen, but people can see the questions directly within Menti, and you will then be sharing a screen to show us the responses from that. Is that correct,
That's
Joe?
right. Yep.
Okay.
Once we've got people in there, then we'll switch over and show the results in just a moment.
Okay, great. So if everyone can open that up and take a look. The first question that we've got is on the challenges that you face in ensuring evidence for impact in and on childcare reform. So let's take a couple of minutes to think about that. Type your answer into the poll, and the feedback should then seamlessly flow into a collective feedback. Some of the challenges already highlighted today were around issues of capacity, longevity, how to engage other stakeholders, the resources needed for that. And so hopefully that can give you a bit of a starting point to think about what are the challenges in your own context. So we've already got some feedback flashing up here on the screen. Now, I don't know how many responses we might be getting. I don't know how many people are on this webinar today, but the numbers are flashing up. So I'll just give you another minute or so to think about it and put in your feedback without me speaking, and then we'll run through it. Okay, so we've got 15 responses in. Please do continue typing, but I'm just going to run through some of them and you can see them on the screen in front of you. So the first comment here is rigorous evidence doesn't exist. So that's a nice bold statement to kick us off with. And then often what is numerically measurable doesn't capture what's actually meaningful. So evidence is a very Western way of thinking of impact. Is it what actually helps in the communities themselves? So that's a really interesting challenge in terms of perspectives and what we mean and think of when we say the word impact. Is that really making a difference in communities? Is that going to change things for children and families? Government seal stats, and that limits research. So I think that's referring to perhaps research and evidence and data that's collected but then is not made available, that's perhaps kept behind closed doors, used by certain governments or decision-making authorities but not shared, either left on a shelf or not shared. Or perhaps though the data that's needed to conduct research isn't available. Feedback from decision makers, perhaps lack of feedback from decision makers is mentioned here. There's a challenge around the formats that work for target audiences. I think Lumos really touched on this in their presentation around the research pack, the different kinds of audiences, the different kinds of materials that need to be presented. And I'm sure if we unpacked that, Lumos, there would be plenty that you felt you weren't even able to cover particular audiences and targets, because really there's such a broad audience for research and evidence. Another feedback is around making sure that researchers are asking questions that are not just academically interesting, right, but they can also inform change at policy and practice levels. So that's bridging that divide between academic interest and academic methodology towards real change on the ground that can inform policy and practice change. Again, translation of research so that it can be absorbed and understood. The time-consuming and resource-intensive nature of research, and a point here on how to collect evidence for those for whom English is their second, third, or seventh language. Does the collection of evidence in the English language hinder the work itself? Now, those are the ones that I can see on screen. Oh, okay, right, we've got plenty more coming down here. I don't think I will continue to read all of these out just in the interest of time, but I think what we can see is, for example, we've got that research simply isn't happening, that it takes a really long time to see that research come in, and perhaps the challenges on the ground are more immediate, more urgent, more time pressing, to be able to wait for the outcomes of research. There's the donor question, donors being motivated and convinced by evidence program change. There's a point here on local evidence. If you just stop scrolling there, Joe, there was a point on local evidence, which I could interpret to maybe mean, is the evidence that's being produced, is it relevant at local level, or is it relevant at global level? Who is the audience, and who is this evidence being produced for and provided to, and where's the gap between perhaps the global, the regional, the local levels of that? We've got stakeholder buy-in, limited funding again, the intensive nature of participatory research, cultural and contextual differences. So there really is a lot in here, balancing the qualitative insights and the quantitative results. And so I think what we're seeing here is that the challenges are numerous. The challenges are really presenting a lot of barriers, I think, to the individuals and the organisations and the funders who potentially want to get more engaged in building the evidence underpinning the care reform sector, and these are things that collectively we're all trying to battle against and come up with solutions for. So the next question that you can see here, if we jump on to the second part of the Mentimeter, is what good practices do you use to help take evidence for impact? Of course, we've heard plenty from the panel today, but what strategies for success have you found to be particularly helpful in your own work? So please continue to put more feedback in there. And I will start by just reviewing some of the responses that are coming up from the audience. So, good practices, extracting key messages to build conversations. Okay, I like that. That's it. So it's about building conversations. Yes, there's a depth and a huge amount of rigor and detail within the research, but actually extracting the most important messages to build conversations without potentially overwhelming the audience with all the details of the research, but pulling out what's really most relevant to build that conversation with a particular audience. Accountability to those served rather than those in power, or even those we're trying to persuade. I mean, absolutely, how poignant and important that point is. Accountability to the children, the families, the young people, the communities that we are serving and that the research is intended to serve, and the issue of power and how that permeates within the research process is a really important one. So I love seeing that one of you has brought that as a real good practice that you are implementing in your own research about that accountability to those we serve. Willingness to expend resources to rigorously evaluate your existing program, including with randomized designs and control groups. Okay, so there's a particular approach that that does require resources, but can bring huge dividends. The involvement of key stakeholders as part of the research process in different ways to transform their knowledge, their ownership, their sense of responsibility for addressing issues. Great to see that coming up here. Collaboration between researchers and policy and programs actors. Including evidence in presentations, sharing it widely, engaging colleagues in conversations. So taking the evidence that you've got and hammering it home, putting it in presentations, putting it in conversations, putting it in roundtables, placing that evidence, that knowledge, that insight in front of people, people who maybe need to hear it, or maybe we don't know they need to hear it, but the potential of using this data to start conversations. Appropriate presentation of evidence, clear and accessible communication. And here's a point around starting small to gain buy-in. So not necessarily jumping to the full bells and whistles version of the research or the dissemination, but starting from a small scale to generate that buy-in and move people along that research and knowledge evidence building process with you. Convening academia and practitioners together over consultations. We have been publishing an academic journal for the last 10 years on family strengthening, and I need you to scroll down a bit, Joe, and alternative care in Asia. Okay, so that's from a particular participant's experience of publishing an academic journal and the power of convening academia and practitioners. Excuse me. And then related to one of the challenges and the success routes we've heard about, going back to those who are the subjects of research and needing to own and challenge the findings, identifying what other research may be needed as well as responses. So some of you have been highlighting the successful or the important approach around engaging young people and children and families within the research, and this one is really this point is really highlighting the need to feedback. So in whatever capacity those young people are involved, feeding back to them, or those communities, those families, feedback the research. Do not just extract information, extract data, extract evidence without returning the insights from that back to the communities involved. we've got 3 minutes left, so I think I'm going to have to wrap up there. Thank you, everybody, for some really insightful comments and feedback. I hope that this conversation today has been an interesting and useful for you. I found it incredibly rich and interesting. Please do feel free to follow up with myself, the participants, the working group, with any further questions. I would like to take a very brief minute to hand over to Florence at Better Care Network, if you're able to jump on, Florence, just to hear any final reflections or thoughts from you today.
I am, and it's going to be very brief. First of all, to thank you, Victoria, for brilliant moderation, to our panelists and to all of the participants for some incredible input. My only things that I will add, because I think the last discussion is so rich, is please join the Evidence for Impact Working Group. The aim is to share learning as we have today about the approaches, the research, the connection to advocacy, the different methodologies, but also to identify how we might together address some of the challenges identified in terms of funding, in terms of engagement, in terms of ethical issues, and most importantly, in terms of having greater impact on children and their families. So thank you all. We look forward to having you join in different ways. And thank you again to our panelists and everyone involved. And thank you. Bye-bye.